you want me to take the omentum off the transverse colon? Or
That's what you do.
Oh, really?
Right.
The students spend some time on surgical teams, and some of that's time spent in the operating room, some of it's time spent on rounds.
But it's a unique educational environment because you have a person actively operating on and taking care of and performing education. What are the other important structures in the retroperitoneum?
You said retroperitoneum?
Yeah, in the retroperitoneum.
Okay.
Table down, please.
I was diagnosed with a bilateral sensory neural hearing loss at 3 years old, and it's about a 90 decibel loss, which is considered profound, and I wear hearing aids in both ears, and I compensate pretty well.
Amanda can pretty much take care of herself in almost every circumstance. She's a very accomplished third-year student. The operating room poses a special problem, though, because everybody's wearing masks, so you can't lip read. And even if you can hear a little bit, there's a lot of mumbling that goes on, and if you're mumbling behind a mask, then it's very difficult to hear.
A little bit more towards the colon, you were thinking?
Yeah, okay.
Oh, I was thinking ahead and dreading it. At that point, not really knowing what kind of accommodation I would be able to use in the OR.
Amanda came up with the idea. She had heard about it from another institution, this notion of being in the operating room and having somebody listen to what the doctor was saying and write it down so that you could read it off a screen. And then she said, well, I'm going to do surgery, why can't we do it here?
It's much like a court reporter. They have a stenograph and type everything word for word.
Okay, now feel to the marginal pulse.
We're using the internet as a live communication between where they are and the OR.
So you take that off, then you can see the splenic flexure.
The main thing that I use it for is when they're quizzing us in the middle of the procedure, especially questions about anatomy.
We're sort of asking them questions, what is this, anatomically. Amanda, they talk about a line on the lateral aspect of the valve. Do you know what that line is called?
At other points, there'll be commands like hold this retractor or cut this suture.
So Amanda, what you gotta do is at times open up one of the ports. See that? Air one. They are going to be our future physicians or even surgeons, so they need to do certain portions like doing suturing as well.
I am able to actively participate in the surgery, which makes it, of course, more interesting. I use visual cues. A lot of times their posture changes, their hand changes. There's a pause, so I'm like, okay, well, I better look at the screen, or I better look at the field. It's really a visual game.
What I wanted to do was actually not think differently so that her experience would be no different than any other student.
Now, deaf people are visual learners by nature, so it's nice to be able to take part in something that kind of uses our strength.
If she had the motivation, we had to bring in the means.
We have a variety of different medical students with different interests, different backgrounds, different disabilities, etc. And the point is to provide them all with a roughly similar experience. Who knows, Amanda may decide she wants to be a surgeon. And if we said, well, she can't hear, so she can't go to the operating room, well then the experience she'd have would be inferior to the experience that all the other hearing students would have, and that's just not right.
UC Davis is a very diverse institution. What we want to do is make sure that those needs are addressed. And what better example than what we're doing right now.